So the process of digitising our pathway was definitely a very complicated process in the sense that we have a very extensive questionnaire, and what we tried to do is not just digitise the actual questionnaire that we were doing, but to add layers so that we could build in the optimisation opportunity, which just added that layer of complexity. So what we would do is choose the risk scoring systems that we wanted and then built those trigger questions into the questionnaire, give the logic behind the questions that we wanted to ask, and then to start training our staff in terms of a different way of working, because we now have that opportunity to have that clinical input to our patients earlier on in their preoperative journey. So definitely what we've found is, whilst the actual digitisation part of the questionnaire was very straightforward, the processes surrounding the new way of working has required ongoing collaboration and input from our team. What we've found since we have done that digitisation is an improvement in patient response rate. So we were having about 30% unfilled patient health questionnaires whilst it was done on paper, and that's improved to an 80% registration rate from invitation to the digital platform. We've found that the patients have been very happy with the frequent touch points that they've had in their preoperative journey, so that they feel like that they're actually moving forward in their preparation list, as opposed to getting a letter at the start and then a phone call saying we're ready for you for surgery. And our staff have been very happy to receive the automatic calculation of risk scoring to help us direct the resources to the patients who need it most, but also just to have visibility of our upcoming patients way earlier than we were previously having. So in the pre-admission clinic, we can prepare our patients prior to the patient actually arriving in the clinic, and that has meant that the time that the patient has spent in the pre-admission clinic has reduced by more than half. And we're also not needing to see as many patients face-to-face in pre-admission clinic, because we're able to sort out what other issues they have just over the telephone because of the information we have from the digital platform. As an anaesthetist in theatre, we've also been able to get visibility of our patients earlier as well, which has helped us as we plan their anaesthetic for the procedure. Whereas before, when everything was on paper, we'd only be able to make those plans when the patient rolled into the anaesthetic bay itself.